Thank you to the participants who are on and ready to go. I'm just going to give it about 60 more seconds. I'm posting to Facebook to encourage a few more people to join us this afternoon and give them a chance to hop on, and then I'm ready to go. Well, good afternoon. I am State Representative Lori Stone, and I am happy to join you for a District 28 update. So I represent West Warren and Centerline, and I believe in accountability and transparency. And so having these conversations is important to me, making sure that the community knows the latest from Lansing, and that any questions you have, I can help answer or help find an answer. So I enjoy having faces to reach out to. So I like the Zoom format. So I feel like I'm talking to people and not just myself. But I do, for security purposes, have the option of switching people from attendee to panelists so that we can have these conversations, but hopefully prevent a Zoom bombing, which is quite unpleasant. I've experienced it. So if you see me click over, it's someone who's joined the meeting, and I'm going to add them to the conversation. I just wanted to invite any participants today to go down to the bottom of your screen and select chat and add your contact information, just a name and an email address, so that I have a record of attendance. And I also have a means of following up with participants if there's questions that you need additional information for. Also, at the bottom of the screen, there is a Q&A bubble that if you have questions that you'd like me to ask about a topic, feel free to post it. I'll make sure that I go back to that, but I'll also try to open the floor to conversations about topics as we discuss them. Okay, that takes care of the housekeeping. I have a short but important agenda today. I also want to open up the floor and address issues that are important to you. So let me start off with unemployment. I'd say probably about 90% of my time, along with 2 full-time staffers, is dedicated to unemployment. It's an issue that's impacting our community as well as the state of Michigan. So as of this week, the state of Michigan has helped over 2 million claimants who have filed for benefits and are eligible. They have paid out over $5 billion of eligible benefits. And I remind people, you know, we pay into unemployment insurance for this very purpose. So I get a lot of people apologetically or concerned about judgment that, you know, I've never been on unemployment, I've worked my entire life. And I just remind them that unemployment is an insurance program that we pay taxes and pay into from our paychecks so that it's there when we need it. And it's situations like this, COVID-19, or any other, you know, recession that we can't anticipate, and with full intention being there to work, but we have it to fill the gaps when we need it. So even though the state has done an amazing job of ramping up to unprecedented demand that it was never prepared for, and quite frankly, underfunded and cut along with software that was not meant to be user-friendly. So as a legislator, I'm working with other legislators to create policy that makes the system more user-friendly and makes sure that the benefits provide for what users need. But that being said, nonetheless, we still have a significant portion of applicants who have not had their claims be resolved yet. So I have well over 500 people in that have filed inquiries on their behalf, with the Unemployment Insurance Agency. We know that because there's roughly 150,000 people waiting for their claims to be reviewed, they might have complex claims or additional problems that need to be managed by their agents, that the waiting list is long. So what started out as a 7 to 10 day waiting period expanded to a 2-week waiting period, then it was a 4-week waiting period, and we're looking at a 6 to 7 week waiting period. So we know that's unacceptable, that there are people trying to make resources stretch, have exhausted savings. And so in my office, in order to meet needs, I have put together a resource list for people in the community to get referrals for emergency needs, as well as food access, what's available in the community. And we're trying to help people get through, get by with the basics till they can get their eligible benefits. In addition, we have people who are reaching out to credit unions for short-term, low interest or no interest loans to provide for those basics. The governor's executive orders also provide for bills and prevent evictions. So I encourage anyone who reaches out to my office to contact debt holders, anyone who holds, debt or credit for your car, your mortgage holder, and be upfront with them. I am unemployed. I have benefits that are pending eligibility, waiting for them to be paid out. And they will be very familiar. People across the state and across rights, you have protections, and if you need assistance with that, reach out to me. You can email me at Lori, Loristone, at house, house.mi.gov, Gov. And I can help you to navigate that. So in addition to the more than 100,000 people who are waiting for their claims to be processed, we also had fraud, people taking advantage of this situation, criminals who have been collecting identifications through a variety of fraudulent methods, and then look for an opportunity like this to take advantage of. So they've been filing fraudulent claims. And so the Secret Service at the federal level has advised states that they have to take actions to prevent ongoing fraudulent behavior. In order to do that, they had to freeze 300 or stop payment for 340,000 accounts in Michigan alone. And they had to go through and get additional identification and authenticate it. So they've been making good progress out of those. They've handled over 200,000 in the last couple weeks. However, they still have over 120,000 cases that they need to verify. Of the claims that they have authenticated, over 50,000 accounts were found to be fraudulent. Often people had no idea that a claim was filed in their name. And by being notified by state unemployment, they came back and said, nope, this isn't me, please fix it. And those fraudulent cases have been resolved. But again, we have people who are waiting and resources that are spread pretty thin at the unemployment agency. They've staffed up from about 200 personnel handling cases to over 1,000. And each of those have different levels of experience and ability to handle cases. So, your most experienced people can adjudicate claims, and some are just in place to verify identities. The plan is that once identity verifications have worked through, those personnel will be repurposed for doing more answering phones and communication directly through the department. Because there is not enough personnel to handle those direct communications, that's where your state representative and legislators come in. So we are customer service. It's not something that we had anticipated, and it's not our usual role, but I'm very glad to be an advocate. It helped to provide that level of communication, help to advise, what the process is going to be. Some people still call and they think that I personally can adjudicate their claim, clear their claim, or move them to the front of the line and expedite it. Unfortunately, that's not my position. That's not in my department. I've offered to go and be trained and work for them because I feel like I could offer, along with my staff, the opportunity to help move things along versus simply updating people as to the timeline. If I had it within my power, I would be expediting things. I also appreciate the word of mouth and social media promotion of state legislators being able to be that intermediary. I see a lot of frustration on the issue, people trying to call and email and spending a lot of time and getting nowhere. So it's a lot of times people that I have assisted who then go back to family, friends, neighbors who are also experiencing difficulty with unemployment, who then refer them, and then I can help them. So getting the word out, not a lot of people understand what role state representatives, state senators, and legislators play. And we are kind of your liaison to government departments and problem solving. So please reach out to me. Do we have any questions on unemployment specifically?
No.
Okay, hopefully that was a pretty thorough summary. But like I said, if anyone does have questions, feel free to reach out and I'd be happy to help. Next up is auto insurance reform. So this is very timely. July 2nd is when this new reform policy goes into place. People are at all different stages. They have already renewed their policy within the last 6 months, and they're not due to renew their policy for a while yet. You will get the automatic coverage under the new law, but it's very important that you're reaching out to your policy holders, your insurance company and provider, to find out about cost savings versus coverage. So, when I was reaching out to voters, it was overwhelming that auto insurance is taking a big hit to their monthly budgets or annual budgets. And that was the big push, is for reform. Upon taking office, I did a lot of homework in order to catch up to what do I need to know about auto insurance in order to help shape policy that's effective. Now, in my experience and undertakings, I drew some conclusions about what would be most effective for controlling costs, which would include increased regulations by the state of our auto insurance companies. Looking at states like California and Hawaii, who have effectively managed costs with coverage. Now, the leadership gets to set the agenda. The Republicans control the House and the Senate. And the proposal that we had, the reform proposal, in my opinion, was not enough. So, while it, on the surface, seemed to address some issues like redlining, credit scores, so discriminatory factor practices, it does not go far enough. A lot of this is very surface and still leaves a lot of language that can be exploited. Also, the savings are only to your personal injury protection or PIP line. So a lot of people think I'm going to get 10% off my entire bill. And if it's $1,000, $100 every 6 months adds up. However, your personal injury protection only covers roughly about 40% of your policy. So you're getting a small savings off of a portion of your bill, but you are also sacrificing coverage. So there's several coverage areas. You can elect to continue complete coverage, which would include catastrophic coverage. You know, car accidents are not planned. We don't control them. It's not necessarily a reflection of you as a driver. And if it becomes catastrophic, it can affect your income, your ability to earn income, and it can have long-term health and physical ramifications that you need coverage for. So whether it's surgeries or physical therapy, we can't always anticipate what our need is going to be. But we also hear that people do need the savings. So there are people that are paying $5,000 every 6 months for auto insurance. There are people that are electing not to they're electing to illegally drive without insurance because they cannot afford it. So we know that we need real meaningful change, and I continue to work on that meaningful change as part of a work group. We're developing policies that help to expand coverage and help to cover some of the holes. I do want to point out that the language for auto insurance reform does leave some gaping holes. So if you are a motorcycle rider, as of now, as the language is written, your only coverage is by if someone hits you, what they have. If they've elected for coverage less than the full amount, you can be left with $250,000 coverage. And that doesn't go very far with a hospital stay or serious injuries. So we do need that filled. I know that I've talked to several motorcyclists who are saying, we wait all year in Michigan for motorcycle riding weather, and now I feel like I have to put it in the garage because I don't have coverage that I'm comfortable with to go out and enjoy it. We've encouraged leadership to take up these bills. Several motorcycle advocacy groups like Abate have advocated that these bills be taken up sooner than later. Unfortunately, they've been put off and told, September, maybe November. Unfortunately, that leaves them exposed July, August until it's addressed. In addition, we still have no-fault insurance. What you elect for insurance coverage covers you and members of your household. So what happens if you are no longer a driver and you don't have auto insurance coverage? What if you are a student or a child of someone who doesn't have coverage? What if you're a bicyclist who doesn't have auto insurance coverage? This again exposes you, and you fall into a $250,000 claim pool. That means the maximum benefits that you qualify for in a car accident is $250,000. And if you are from out of state, then Michigan coverage doesn't cover you. So hopefully what you are coming to Michigan with is takes that into account. So we have a lot of work to do on auto insurance reform. My best advice is to pull out your last 2 renewal policies. And when you take that to your policyholder to look at what your options are going forward, take a look at that personal injury protection line and discuss what do those savings look like and what are you getting for them. If you opt for a $500,000 personal injury protection, $250,000 personal protection, or if you are a Medicaid, Medicare or you have them as your provider, you need to contact your health insurance provider before you waive any benefits and get in writing that you are covered with them as the primary provider before you give up coverage. I have done 2 town halls, one back in November and then one just back in May with the Department of Insurance and Financial Services to kind of provide some of the things that you need to watch out for. DIFS, or Department of Insurance and Financial Services, also has some one-page graphic information sheets that you can print off of their website that can walk you through this. What questions do you need to be asking? What kind of coverage do you need? But you can always go back to my Facebook feed and pull up some of those webinar town halls and sit down. They're about an hour to see what information you might need to take into consideration. Let's see. I'm going to open the floor. That kind of covers where we're at with unemployment. Past unemployment, onto auto insurance reform. Anyone who has questions on auto insurance reform specifically?
Yes.
Go ahead.
I have heard lately on the news that if you are under Medicare, that this car insurance thing is different for you.
Yeah, so under Medicare and Medicaid, written into the law is the provision that you can waive that personal protection policy line, which can be, 40% savings. And for someone on a fixed income, that can make the difference. But you have to make sure with your healthcare provider that they will cover you primarily in the case of an auto accident. So we haven't had to do that, and the onus is on the purchaser to make sure that you have that verified. So before you elect to take less coverage for Medicare and Medicaid recipients or providers, reach out to your health insurance, get it in writing that they will provide that, and then you can opt for the lower rate on your auto insurance to make a little savings.
Thank you.
Does that help? Thanks, Pam. Any other questions on auto insurance? Lori? Don't forget to unmute.
Okay. So to follow up with Earl 1 or Earl 2, what would prevent the Medicare companies from changing their rules every year then?
So in fact, there are some health policies that they will not act as the primary for auto insurance. And so to protect yourself, it's important to ask them, do they provide this?
Right, but say they did this year, but what's going to prevent them from all the Medicare policies from changing next in November, right? So when you sign up again for next year, you don't even realize you've just lost your.
It's true. And this is written into law for 8 years. So that is definitely a possibility. As of now, I would assume that I do not have coverage under an auto insurance, that my personal injury protection is primary until I have verification from that provider that they do provide that as an option.
I'm trying to look mine up right now.
It's a good idea. Okay, well, I'm going to touch on the Return to Learn plan for safe schools. As a teacher, it's definitely something I've been waiting anxiously for. Not a day goes by that I'm not talking to a parent, a fellow teacher, a community member, just people who are interested in what schools look like going forward. So we know that COVID-19 was an abrupt end to in-person education in March, and schools did not have an opportunity and did not have these contingency plans for what are our options when you can't educate a child in person. Now our schools have stepped up big time to provide technology options, to create, to continue to feed students through the end of the school year. And now we're looking at what does 2020-2021 school year look like. We know that we do not have a vaccine option to start the school year. So I've got parents who don't want to send their children because they're concerned about exposure and transmission for their child or for a vulnerable member of the family. So, you might have an older person who is living in your home, a medically fragile person, a medically fragile child, someone with an autoimmune issue, and exposing and transmission is a problem. And we know as a teacher working with young kids at the elementary level, we know cold season, flu season, and any communicable disease, whether it's chicken pox or anything else, because of the close quarters and long contact throughout the day, that kids are a big spread factor for spread. So a very thoughtful group was pulled together of both stakeholders, parents, a student, healthcare professionals, and educational professionals were brought together through the Return to Learn Advisory Council. And they thought through a lot of these things. They took advice from CDC and public health guidelines to provide, it's a 63-page document to districts so that they can individualize and customize their Return to Learn plan. So while many districts and even counties will collaborate to come up with consistent learning plans the best they can, district to district based on need and available resources, that could look different. The phrase of the day is flexibility and grace. So while we have families that are anxious to return their students to the classroom to work and get that experience, they're trying to balance working remotely as well as childcare and their child's education, which is pretty complicated. Again, schools are trying to come up with contingency plans. Many are coming up for plans for, okay, if transmission just explodes in the next 3 months and we can't return students to full-time in-person instruction, what does that look like? Many districts are partnering with programming or online virtual schooling. So your child would still be enrolled in their local school, local districts, but they would have access to educational software so they could continue to learn from home. In addition, there is looking at a plan for a hybrid system. So we know that we need increased social distancing space. We need, which will mean that fewer kids in a space at one time. And so it might look like, you have odds and even days. Your child attends on odds days and another group attends on even days. We have to take this into consideration from getting on the bus in the morning and commuting to and from school to, do they have specials? Do they have recess? How do we feed them? Is it in a cafeteria or is it in a classroom? This is a lot of very thoughtful and complicated planning. Our hope is, as our transmission rates go down, that there will be less virus circulating in the community, which makes it safer to bring more groups closer together for periods of time, which would allow for complete return to the classroom. And as a teacher, I believe, and I know a lot of people appreciate now, how important it is to have that direct contact with students. So, when I hold a reading group and I have 6 kids in front of me and each of them are 1.5 feet from me, face to face, and probably shoulder to shoulder around a reading table, as teachers, we have to look at our best practices and reimagine them for what is the best practice we can under the situation. So it will be stressful for parents. It will be stressful for teachers and students as well. Also have anxieties about what does this mean for them. Changing conditions, it takes out some of that comfort and security and predictability. And so I'm sure kids will have a lot of questions, and it's important to have these conversations about what we're doing to help protect them, keep them safe and healthy. So grace and flexibility. And I encourage you, districts will be sharing out pieces of these plans, and they will probably be asking for parents to weigh in. They've been sending out surveys to get feedback, and it's important that share your thoughts, but also I encourage people to kind of understand where other people are coming from, because we don't always agree on what we expect or what can be provided. So understanding is important. And with that, I'm going to open it up for questions on safer schools. Let me see, I see a post. So there, in the post, there is some concerns about the cost. So, we already are facing a budget shortfall for the state because of the reduced tax collections. So up front, when we were seeing that we have like a $6 billion shortfall statewide, that would require considerable cuts. Cuts not only to education, health and human services, public safety, local governments. And so the governor and leadership in the legislature have been looking closely at budgets. We have savings that have been set aside for situations like this. I don't know, like this, but emergencies, crisis that would take a hit to our budget. And so they're allocating funds from that savings. They're making cuts to budgets where they can, and allocating already federal CARES dollars that have been sent to states to make sure that we're starting to cover those holes in the budget. So this isn't just going to be for this year. We expect hits to our budget for the next couple years. And so we don't want to dump all our savings account into this year's budget. We need to plan that we're going to need to use that to help cover future budgets as well. And we're also asking the federal government for additional investments. So return some of Michigan tax dollars to Michigan, like we would for a FEMA emergency, like we would for a natural disaster. And $6 billion from the federal government isn't a huge investment from the federal budget, but it can go a long way in covering our expenses as well as boosting funding for schools. So we recognize that what we were investing in per pupil funding was not even adequate with what we were functioning under before. And now we're going to expect we need additional wraparound services, social workers, school psychologists, interventionists, reading specialists that can help students who've fallen behind. And so that's going to be a higher cost. In addition, schools are going to have to perhaps provide more bus routes, more supervision to spread out kids, also personal protection equipment for teachers and staff, as well as for students, and additional costs for cleaning and sanitation. So, I encourage our superintendents and intermediate school district to be very upfront with the state of Michigan on what additional costs, and making sure they provide a dollar sign that goes with that. Not to mention that we have areas of the state that doesn't have Wi-Fi coverage or adequate Wi-Fi coverage. And so what we like to think about, what is our child, our student, our district getting for resources? As a state representative, I'm also looking at, we need to provide equitable learning for students across the state. And so making sure that we provide for that as well. So we are asking for that support federal funding to help round out our schools, so that there was kind of some scary language that we're going to cut $800 in per pupil funding because of this budget shortfall. This isn't something we can cut our way out of. We need to invest and treat this like a natural disaster that it is. And a lot of teachers are concerned about how do you teach wearing PPE all day? It can be hot, it can feel claustrophobic. I've talked with parents about mask training their kids. So starting with 5 to 10 minutes a day, let them pick out a material that they can get excited about wearing and expresses who they are and something they like, and help build up their stamina and tolerance, and talking in an appropriate way about why it's important. And their potential for spreading germs, the importance of good hygiene. And there's going to be instructional time that will then be dedicated to bathroom breaks and hand washing sessions to make sure that we keep our spaces as clean as we can. And I always appreciated parents who sent in Lysol wipes and hand sanitizer at the beginning of the year. I know those are hot commodities. Getting your hands on them now is a challenge. So if you can secure some and set it aside for the start of school, your classroom teachers will be very appreciative, and it would help keep the spread of virus from coming home with your child too. Any other questions about return to learn and safer schools?
Hello.
Yes.
I don't know if you saw my post in the chat. I am a school teacher. I work in the large urban district in our state or in our area. I'm working in a district that has been decimated by emergency management. I work with a population that doesn't social distance, that they're not going to be sending in any materials for my classroom. I am in a building that has no air conditioning. If you open the windows, the bees come in. I'm allergic to bees. Some of my kids are allergic to bees. I teach preschool. They're little germ factories. I have no bathroom. The bathroom is down the hall and around the corner. I mean, I'm not allowed to use hand sanitizer due to licensing. So we're going to just be constantly walking to the bathroom. We can't social distance. They're cutting staff. I have a compromised immune system. I don't want to retire. I don't want to be pushed out because of this, but I am not feeling real happy about going back to work. My superintendent is not really making any plans. I'm on the focus group for my school for return to work, and the principal's saying she doesn't know how it's going to work. And there was not one single teacher from Detroit Public Schools or any other big urban district on that panel. So we're comparing apples to oranges. What we have in the more affluent districts, like where my sister works, compared to what we have in my district, it's like a great, huge divide. So I don't know. I'm not happy. I'm worried. I don't want to die because of my job. I love my kids. I want to go back. I taught preschool all since March. Online is not developmentally appropriate. It was not a great experience overall. And I cannot see starting back that way either, especially with kids that have never been in the classroom. At least the kids I was working with recently knew me and were exposed to what we were doing. I am very apprehensive. I wish I had solutions. I don't.
Well, I appreciate you sharing your concerns and your apprehensions. You're not alone. You know, as a classroom teacher, I read the guidelines and I kind of laugh to myself going, what is this going to be? How is this even possible? I also appreciate you stepping up in an advisory capacity for your district to kind of weigh in and filter these thoughts. You definitely shared concerns that are representative of our profession and need to be weighed with, given a lot of consideration. And weighing in and expecting that your school district will provide you that guidance. So every business that reopens has to create a COVID-19 return to learn plan, or I'm sorry, reopening plan. And schools are the same. So looking through that, raising the questions that you're raising as to what does that look like? The expectation is that the state is going to give school districts a lot of flexibility. And so it's going to come with a lot of creativity, out of the box thinking. And I think there's nobody better than teachers to propose solutions. So if you have ideas, some of the things that might have been past precedent might be out the window. So if there aren't sinks in the classroom or bathrooms close by, hand sanitizer might be open again. I'm continuing to work with and be in contact with teachers. I want to hear from you what you're seeing that's working, what you would like to see, what would you like to be added or considered, and help troubleshoot. So any of that insight is welcome. And again, reach out to me, email me at Lori Stone, that's LORISTONE at house.mi.gov. And I'm part of the Education Policy Committee, and I'm active in this. I'm working both with local districts, schools. I've been in touch with union leaders, and the more voices that are heard, the more we can troubleshoot this. It is in no way ideal. Nobody is saying that what this is doing is best case learning. Mostly we're providing that Band-Aid, that gap coverage, until we can resume what looks like a more traditional and best practices. And we're going to continue working until we can return to that. I'm just going to give it another few seconds to see if there's any additional posts or questions about that. And then the last piece I have is a COVID just kind of update and advice, and then I'll open the floor and I want to hear from you. Okay, I'm going to wrap return to learn and head over to COVID. So while Michigan was one of the hardest hit states with COVID transmissions off the bat, we also had very stringent and strict lockdown. I don't know if lockdown is the word, but advice on how to manage this. And we had a lot of success along with New York, New Jersey, in helping to resolve the transmission rate. But as we got lower and lower, when we see deaths in the single digits. It's a little disturbing to think that you can get excited about that, but that's a considerable improvement from where we were 2 months ago, when our hospitals are returning to normal procedures and being able to serve all the other hospital-related services instead of just being overwhelmed by COVID-19 and ICUs that were being dedicated basically to ventilators and life-saving measures. However, as our numbers drop, it's also, when you feel like you've been on restriction, I feel like you're a teenager who's been grounded and all of a sudden your time's up and all of a sudden people want to return to normal. So as things are opening up because our numbers are improving, it doesn't mean that the virus and the transmission aren't in our communities. And so if we want to keep the access, the openness, we need to be very personally responsible in our decision making. Wearing masks, I understand they're not always comfortable, they're not always convenient, but they do reduce the spread and they're important. So it's important to be respectful of others. We know that this is a disease that hides in plain sight. The people who are carriers and transmitters aren't always visibly symptomatic, and you can start transferring that to other people before you experience symptoms. So the basics of hygiene, washing your hands, respecting distances, wearing masks are hundreds of years old, is what's worked and what we continue to depend on until we have vaccines and other ways of preventing this. So even though it can feel like, okay, I can go to a bar or a restaurant, we need to remember that you can't always tell where that transmission is lurking. And it's important for businesses and management to set the tone for their organization, for the protection of their employees, as well as for their customers. So businesses that are not consistently making sure that people are wearing their masks and respecting those, the plans, need to be more vigilant. They need to set that tone. Once people realize that when I enter this environment, this is how it will be enforced, they tend to accept that and stop testing what the boundaries are. We are seeing increased openings, but the governor has reminded us that if there's high rates of transmission, like we've seen in Ingham County and the greater Grand Rapids area, and as people start traveling with summer vacations, you know, we've seen transmission rates in Traverse City. We can not just have transmission in small areas, then people return home, they bring it back to their community, and it can cause widespread transmission. So preventing it, not putting yourself into a situation that increases spread, and then testing and tracing. So I've had a lot of people reach out with a lot of myths and misunderstanding about testing and tracing. So nobody is being forced to be tested, although the state is expanding access to testing as there's more availability. People are encouraged to participate in testing. So I was able to attend. There was a pop-up drive-through in collaboration with Wayne State's Research Medical College. And so one, I could get some peace of mind for where I am with diagnostic testing, as well as antibody testing, as well as they can use that data to help inform decision-making and to do research to people who are currently experiencing COVID or have recovered from COVID, we still don't know how much immunity people carry through from having it. So it's still a new emerging disease that we're continuing to learn about. And then contact tracing. So there are people that are concerned that they're going to be locked in their house with a guard out front. They're going to be compelled for quarantine. And I just want to provide some insights. So our public health departments are responsible for when someone has received a COVID positive test to reach out to that individual. And what will happen at that point is they'll start to create a case history of our contact history. So anyone that they've been in touch with in the last 3 to 7 days who they could have potentially spread it to. They then use that list to reach out to those individuals, or in places where it was a bar, a store, where they might be widespread transmission, they might publicly post that on a news station or on a public media, social media type format. And then from there, they will reach out and daily check in with you to see if you are developing symptoms. They will also provide you with potential places to seek testing. And then, and if you develop it in that time, they will advise you on quarantine and self-isolation practices, as well as help to support you so you can self-isolate and not transmit it to the general public. So they can help provide food. In some situations, they've been able to help provide housing for individuals and meet those basic needs so you don't feel you have to go out into the public to get them met. So they're helping to protect the public, and they're also helping to protect your health and support you as you recover. And that tracing helps to limit spread, and it keeps transmission from getting out of control. So in countries and in communities where that testing and tracing has been effectively implemented, they've been able to reduce that transmission rate and control the spread. I think that touches on where we're at. We're very close to that next level of opening up. We just need to be more mindful and make good choices. So with that, I'll open it up to additional questions on COVID, where we are as a state, as well as general questions and answers. What do you want to know about?
Hey, Laura.
Yes.
I want to know why we don't have testing in Warren, significant testing, and how to work to get this going.
So we do have testing within the boundaries of Warren.
Well, at the My Care,
yeah.
Right.
Yeah. And so even though its address is in Centerline, it's at the very heart of our community. Some people ask, versus South Warren, south of 696, it's there at 10 Mile in Sherwood. It does have a drive-through option. I encourage people to call. You need an appointment, but also to find out what their procedures are. So when you want to be tested, you no longer need a prescription. You don't need to be symptomatic. I know that when we had a lot of widespread transmission, we needed to restrict testing capacity for identifying immediate needs. And as that has gone down, we've been able to increase access. So in addition to My Care, we've had a couple pop-up, I refer them to a pop-up, like a pop-up in a store, facilities provided through the city of Warren in collaboration with some local organizations like the Wayne State Research Project.
Right. I'm concerned about the seniors who can't get out. Mm-hmm. If there are any, I don't know who's planning these things, even through the city, because I can't find out. But it would be nice to have, in preparation for what will appear to be a flu season that includes COVID in the fall, a way to help people get tested, especially the people that can't get out of their houses. And then the second thing is I signed up to be a COVID tracer, through the state. And
Thank you.
yeah, but apparently they don't need me. And I did the training, and I don't know if it's when they switched to the other, is it Rocket that's doing it now?
Yeah, I'd have to look more into it. My understanding is it's through the health department, but I don't know if they're subcontracting it with a program or software. I'll look into that some more. I know that we were in desperate need with the amount of transmissions to have adequate staffing. So I appreciate you stepping up to do that.
Yeah, several of retired nurses that I worked with have signed up. So, and one is bilingual. So it's all a process, but I think we have a foretaste of what we could need in the future. But I would love to see better access for the seniors.
Yeah. So some things I can speak to is I'm on a work group for preventative measures in nursing homes. So we know that vulnerable population being housed in close quarters with workers. I know we cut off a lot of visitors, but still workers are going home into the community and have that potential to bring it back. So our National Guard was tapped to help provide either test kits so they could supply it to the staff, as well as in person, they would come into the facility and test everyone. They have very regimented testing procedures to prevent that from flaring up again. We've been able to manage transmission in senior residences. I've worked with Centerline Park Towers, where it's an independent living facility. So it isn't a residential or state serviced facility, but these are still a lot of times senior populations or vulnerable communities still living in close proximity, shared elevators, and they've expressed concern. And so my care and the Department of Health for Macomb County have both volunteered to go into their facilities on site and do testing for residents. Okay.
Good.
So if you know of a facility in my district, or we can help put a facility in another area with their representative, we can help find the community provider who can go in on site and provide that.
Okay.
And it might be a little different. We do have seniors. I have neighbors who, are mostly homebound, who hopefully that will protect them from exposure, but might want testing. So, arranging with a primary care physician for, a community location where they can secure that.
Okay, thanks.
Yes. What other questions do we have? What other priorities or issues in the community? You got another one, Lori?
Fireworks.
Thank you.
Oh my gosh.
Yes, I feel like 1 month a year, I live in a war zone. The amount of, I feel like mortars are going off in my backyard, and it can go late. Now, the state and our local municipalities have continued to tighten regulations. They've limited the window to celebratory periods around holidays and restrict hours, but it's really up to enforcement. And I have been that person. I have been that teacher getting ready for summer school that needs to go to bed, as neighbors have been setting off who have called enforcement and said, hey, can someone drive through my community? Can someone send a patrol down my street? I hate to be the person who's like, complains, but I have some rights to a peaceable neighborhood. And I also feel a lot of compassion. We've got a lot of pet owners who are the pets are very sensitive to these noises. And, you know, it's not just one night for 3 hours. We see this going on for weeks. So part of it is community expectations and asking, you know, you don't have to call 911. Our law enforcement has non-emergency number that you can reach out to and ask for these. You know, ask for stepped up patrols, ask for support if you know that there are streets or areas that are taking advantage of abusing and moving past those set limits, and ask for them to be enforced. But I agree. And, you know, also consideration for veterans who are experiencing PTSD. And not just to mention that people want to go to bed at a reasonable hour and not feel like the walls are blowing up around them. So, you know, in years past, the mayor has done some ride-alongs in the community around enforcing, you know, noise ordinances and fireworks. And so asking our city council, asking our local police departments and mayor is not an unreasonable ask. So feel free to reach out. They work for us, just like I, as a local elected official, work for you in the community. Ask for what you need to get your needs met. Well, it is 1 o'clock and I'm going to widen it down. I have some help. This has been recorded, and what we're going to do is I'll repost it. I'll try to put some timestamps on it. So if you have someone who could benefit from this information conversation, that they don't have to sit through a 1 hour presentation, that can jump to a segment on unemployment or auto insurance and use what information that would benefit them. So help get out the word in the community. I appreciate your time and your input, and thank you. Have a good day.
Bye, Lori.
Bye.